Welcome to the Wholehearted Wellness Podcast. As a friendly reminder, the Wholehearted Wellness Podcast is not a substitute to receiving mental and physical support from a licensed wellness provider. We encourage you to speak with your wellness provider prior to trying any therapeutic modalities mentioned on this podcast. Welcome back, everyone. Today, I have one of my wonderful counselors that works for me at Lotus Counseling and Wellness. Her name is Lillian Wiser, and she works with a wide variety of people, but one area that she focuses with is helping those that experience addiction. So, Lillian, thank you so much for being here with us today.
Absolutely. Thank you for having me.
So, tell us a little bit about you and what brought you into this profession.
Yeah, so I'm a provisionally licensed professional counselor. So I have about 3 years of experience, and I have been working in addiction and mental health. And I've done crisis counseling and also a lot of different varieties of settings, from inpatient work, residential work, private practice work, other types of outpatient programs. So I am excited to share a little bit about what I have learned the last 3 years about addiction and just why it's so special to my heart too. So
That's awesome. So I know we said that your area of focus, or one of them, is addiction. So tell us about what addiction is.
absolutely. So addiction is something that I get asked about a lot. Like, how do you know if what you're dealing with is actually an addiction, or if you just use that recreationally, or it's like a part-time coping skill? So the difference between a just random recreational use of something and an addiction is that no matter how many times you might want to say no to using, you continually find yourself going to it over and over again and saying yes, to the point where whatever you are drawn to has power over you. And you don't feel that you have the free will to say no to that anymore. So that's where you might realize that you have an issue with it, is if you find yourself continually saying yes when everything in you, even when it becomes really unenjoyable, you continually say yes when you want to say no.
That makes a lot of sense. Almost like it's controlling you, where it's just constantly on your mind and you can't put it down, don't have any control over it at all. Yeah.
Absolutely.
Okay. So tell us, what are different forms of addiction? Because I know, man, you don't necessarily have to be addicted to a substance to have an addiction struggle.
Absolutely. So there's all different types of addiction. There's the ones that you hear about a lot, which is drugs and alcohol. There is also addictions to food, sex, pornography. People have different types of addictions to a lot of different things. Another common one is smoking. But there can be any wide variety of things that you might get addicted to during a point in your life.
Okay. What often leads to addiction?
Every journey to addiction is different. Some people try something once and become hooked. Some people experience a traumatic event and are trying to numb anything out with their feelings, and so they'll resort to that substance in that moment. No person has the same story, and no person is attracted to a substance for the same reason. So the reason that a smoker is addicted to smoking is going to be different for every person, and what they're attracted to about the cigarette is going to be different, or vape, or whatever form that they're using.
Sure. Would you say there's also a genetic predisposition as well?
Definitely. There's been research to show that addiction tends to be running in families. And there is a lot of study debate about whether that's genetic or if it's something that's learned, because there's oftentimes a combination of both, where you'll have a loved one who's using or who has used in the past, and then you have the proclivity to also be addicted to something later on in life.
You know, I remember speaking with somebody who also works with addiction and saying how there's even like certain genetic lineages, such as like Italians. Like Italians can have a tendency to have lower dopamine and can have a certain tendency toward certain substances to be able to increase that dopamine, which is it's just so interesting to me. And thinking about like, hey, you may be low on iron and you're craving chocolate, how so much of what can play into it is also what our body is longing for and craving.
Absolutely. Oftentimes, addiction will come in to fill a need. So
Right.
your body needs something and it doesn't know any other way to fill that desire. And so you'll end up going to that substance.
Yeah. I remember one time hearing too that, man, if it could even just be where you're not even craving a mineral. It could be I'm craving relief
Mhm.
or consistency or connection. I know I've worked with clients that have said they've found that they were drawn to a certain substance because it was available, like food. I couldn't rely on my parents, but I could rely food to always be there and to meet my needs.
Absolutely.
Yeah. What would you say are signs that loved ones can be aware of and being able to discern, man, do I have a loved one that's experiencing addiction? For those that aren't necessarily addicted to something, but have a loved one that is.
Absolutely. So everyone's addiction is going to look differently. Some people are really good at hiding their symptoms. I've taken a lot of training on understanding when someone is actively intoxicated versus when they're withdrawing for something and what that looks like. But the signs are different for the different addictions. So a marijuana addiction is going to look very different in symptom than a porn addiction, for
Mm.
example. And identifying that can be really difficult. It's a good thing to notice if there's any behavioral changes or if there's sudden shifts in mood and get them to kind of acknowledge that and seek help if possible. If not, if there's a lot of denial or a lot of hiding behaviors, then maybe they're not ready because everyone has this moment where they realize that they have a problem. And until they reach that, there's really nothing that you can do other than just support and love that person and try and hold healthy boundaries.
Sure. No, I will tell y'all, many of our counselors at Lotus, we say Lillian's a wizard because she has this ability to just see someone and she goes, they're withdrawing off of or for overdosing or not overdosing, but abusing
Hopefully
Adderall.
not
Yeah.
overdosing.
But
That's
yeah, yeah,
scary.
yeah, yeah. But like even she's like, these symptoms that show signs that they probably snorted the Adderall or, man, I wish I could pick up on these signs that she can, but yes, we're like, Lillian, how did you notice that? And she's like, oh, this, and this, these symptoms. So it's
Absolutely.
are there resources that loved ones can uh, maybe even find to help them spot these different type of signs and symptoms, or even being able to support someone that is actively using?
Definitely. So, obviously, asking for professional help and guidance is really good because mental health and addiction are very tied together. And so, someone might be having like a mental health crisis, but it looks like addiction or vice versa. So, having a professional look at that and determine what's going on is important. But there is some really great resources out there if you want to do research through NAMI, NAMI. There's also some amazing information on samhsa.org. And it's about specifically addiction and mental health and differentiating the symptoms between those two. There's some good resources for loved ones, and there's also some good resources if you yourself are struggling with addiction. There's also an organization called the Drug Helpline. So if someone has actively gone through some substance use addiction and you want to know, like, are they in danger? What are my treatment options? And speak to someone who really knows that well, you can always call the helpline. Obviously, if someone is in immediate danger, you notice there's changes in breathing, heart rate, something is really physically wrong, then try and bring them to an ER, call 911 as quickly as possible because withdrawal happens quickly.
Mm,
So,
sure. So, what does steps towards recovery look like? Which I'm sure is can be very unique per person, but
absolutely. So, the first step is that initial stage of change, which is them asking for help. Until that point, it's really, really difficult to watch someone going through an addiction or to be going through it yourself because there's a lot of denial and shame and a lot of emotions behind that. And so the first barrier, once they ask for help, it's like my favorite moment in the therapeutic process. Like, okay, yes, we realize we have a problem. Let's make some steps to get better. Let's make some steps so that you can feel healthier and you get your power back.
Mm.
Everyone's journey looks different. Some people need a lower level of care, which means like outpatient counseling, speaking with someone one-on-one. There's also group counseling available. You can attend a 12-step program if you want to do group and have that accountability through that as well. And then on a higher level of care, if there's a lot of substances in the body, detox is really important, or rehab, to get all of that out of your system and to get regulated again. It's good to have medical supervision during that process because it is so dangerous and there's such high potential for lethality. So having a nurse on staff 24/7 is the key thing about detox, and also getting into a hospital if possible. Or doctor, any sort of medical professional. So that way, if something goes wrong and your heart starts acting differently, or there's strokes or other things that happen, you have someone there on site who can respond really quickly.
Yes, that is I don't work with addiction, but that is something I know is it's not recommended to try and detox on your own. Just because you don't know how your body's going to respond as you're detoxing, and it can be really really challenging, and you'll need that support for sure, even just emotionally.
Absolutely. You can go through irritability 1 second, then you're happy the next second, and then you're crying your eyes out. The emotions are everywhere. You're going to feel really, really miserable for a while.
Mm.
To get all that out of your body, the cravings are going to be really increased, and just overall, it's really, really horrible to detox from a substance. So it's good to have medical staff standing by, making sure you're okay physically, having the medication to support if you can, and then also having other people who are going through the same thing
Mm.
so they know. Like, whoever is in front of you in a detox or rehab program who's been there a little bit longer, you're going to go through that next. So you get to watch it happen and have that person there to support you during that process. And that's something that you really can't get without going to treatment.
Mm. Yeah. Thank you so much, Lillian, for coming on. If you have more questions about addiction, I know Lillian is a wealth of knowledge, and you can reach her at Lillian at lotuscounselingwellness.com. And you can go on our website and reach out to our admin, and they can help you get to Lillian as well. But Lillian is, like I said, very, very wise, and has a wealth of knowledge, especially in this area. Lillian also works with those that are experiencing chronic and terminal illness, those in the elderly population. And she also has really, really great knowledge in understanding the legal system and being able to provide guidance in that area. So, Lillian, thank you again for coming on.
Absolutely. Thank you so much for having me. Yeah, I'm available by email. You can go on our website and find more information about me and my experience and meet the rest of our team. And also, you can contact via phone if you want to reach out and ask questions, or you can send a message through the website. And again, if someone is in immediate danger, call 911 or the drug helpline to get more services for them. And thank you for anyone who's listening. I just really want to raise awareness about addiction and normalize it, because the more people that feel brave enough to speak up about addiction, and the more people who normalize it and take that shame away from addiction, the more people that will be able to be helped and feel trustworthy enough to seek help, and also feel like they don't have anything to be ashamed of.
Absolutely. All right, you guys, thank you so much for tuning in, and we will see y'all next time.